Your hospital has begun an initiative to become designated as baby-friendly. This is a big endeavor for you and for your commitment to making the 10 steps to breastfeeding success work in your hospital. This will be an adventure for you and for your coworkers. The staff on the maternity units will be learning about new research and will begin to incorporate new tips and techniques into their practice. They will be reviewing the policies and procedures to see where they can make improvements. It will be challenging as well as exciting. It is essential that everyone is aware of this initiative as it progresses. At the completion of the program, assessors will come to our hospital to review our care for breastfeeding mothers. The assessors may ask you what the Baby-Friendly Hospital is all about. This short program will give you an overview of the importance of this initiative. The Baby-Friendly Initiative was conceived by the United Nations Children's Fund and the World Health Organization. They became alarmed as the worldwide rate of breastfeeding began dropping. They saw that the care that is given in hospitals to support breastfeeding mothers is essential to initiating and maintaining lactation, and often that care was lacking, or even worse, undermining the efforts of women to breastfeed. So they began this worldwide movement to improve the breastfeeding support given by hospitals, the Baby-Friendly Hospital Initiative. Breastfeeding is a team sport. Just as this dog sled team will not win the Iditarod if they're not pulling all together, the breastfeeding support for your moms will not improve unless everyone is pulling in the same direction. It's easy to see that if even one of these dogs is doing his own thing and running off in a different direction, there will be chaos. Similarly, if one or two of the healthcare professionals who give moms advice on breastfeeding are given their own version of breastfeeding advice, no wonder moms get confused and frustrated. Consistency matters. If you listen to mothers a few weeks or months after their babies are born, the number one thing they complain about is that everyone told me something different. I didn't know who to believe or what to do. Physicians and other providers, lactation consultants, registered nurses, breastfeeding resource nurses, aides, or patient care techs, even dietitians or anyone else who might be in a position to give a piece of advice or just even encouragement to new mothers. Let me spend a minute talking about breastfeeding and why we value this so much that we're pursuing designation that shows that we truly support breastfeeding. It's good for babies, it's good for mothers, it's good for families, and it's good for the community. It's also good for the planet. For babies, breast milk reduces asthma, childhood cancer, such as leukemia, infectious diseases such as gastrointestinal, respiratory, and influenza. For this reason, it's sometimes called the baby's first immunization. It's especially helpful in preventing necrotizing enterocolitis, the life-threatening disease of premature infants. Breastfeeding reduces allergies, sudden infant death syndrome, obesity, and diabetes. Breastfeeding improves brain growth and increases the baby's IQ. It improves his lung function and fosters the development of a healthy mouth and reduces cavities in toddlers. Dr. Mark Regan from Australia discovered stem cells in breast milk. The mammary stem cells are blue and red. The differentiated adult cells are in green. These cells guide the growth and development of the nursing baby. And advantages for mothers. It reduces arteriosclerosis later in life, heart attacks, helps space pregnancies as long as breastfeeding is exclusive in the first few months, reduces bladder infections, premenopausal breast cancer, GYN cancer, osteoporosis later in life, gastrointestinal disease, and rheumatoid arthritis. It improves self-esteem in the mother and improves the way she adapts to being a new mother. It aids in her physical recovery, and that's quicker after birth. And it improves bonding between mother and baby and mother, and it's convenient for making life easier for moms. For families, breastfeeding reduces costs up to $1,500 to $1,700 a year, and it improves bonding. Breastfeeding saves healthcare dollars. A study published in Pediatrics estimates that if 90% of American mothers followed the recommendations to breastfeed exclusively for the first 6 months of a child's life, the United States would save $13 billion a year and prevent more than 900 infant deaths. Advantages for the planet. There's less pollution from raising cows, transporting milk, manufacturing formula, transporting formula, and driving to purchase formula. To meet the requirements of Baby Friendly USA, the staff will be taking 15 hours of online training in breastfeeding support and 5 hours of hands-on practice with breastfeeding mothers. Providers, that's physicians, nurse midwives, nurse practitioners, and other mid-level providers, will be taking 3 hours of online training. There are 10 steps that UNICEF and the World Health Organization have developed to ensure that breastfeeding is successful in the time a woman is in the hospital. They form a comprehensive way to look at the care that we deliver to our moms and babies prenatally through the hospital experience and to support the mothers at home. We'll go through each of them individually. Inconsistent advice is a common problem, and it's distressing for mothers. One of the aims of your baby-friendly hospital training is providing evidence-based information so all staff are giving a consistent message. I've heard nurses say, "What do you mean? We are baby-friendly." And I'm sure that every facility that delivers babies has the best interest of the mothers and the babies at heart and consider themselves friendly to babies. However, if you look at the 10 steps, many hospitals do not meet the criteria that UNICEF and the World Health Organization have set up for the designation of a baby-friendly hospital. For now, I will run quickly through each one of these steps so that you're familiar with each of them and what it means to your hospital. The first step is to maintain a written breastfeeding policy that's routinely communicated to all healthcare staff. This means that your hospital has developed a policy of how breastfeeding will be conducted. That was developed in a breastfeeding committee with representation from many departments in your hospital and covers all initiation of breastfeeding, supplementation, use of pacifiers, ongoing breastfeeding support, the use of breast pumps, preparation for discharge, and other topics. This policy is included in the orientation of new staff and reviewed and updated periodically. Step 2 is to train all staff with the knowledge, skills, and attitudes to give excellent breastfeeding support. That's 20 hours of training for staff and 3 hours of training for providers that we're all embarking on. Step 3 is educating new mothers during their pregnancy about the benefits of breastfeeding. To provide the best experience for our mothers, they need to hear consistent messages from all caregivers about the benefits of breastfeeding and how important exclusive breastfeeding is. They need to know the basics of getting the baby to breast early and often, beginning right after delivery. All prenatal education and handouts should be free from messages that promote formula feeding. Step 4. All babies who are healthy full-term infants should be placed on the mother's abdomen and allowed to remain there until the first feeding has been accomplished. Studies show that infants who are skin-to-skin with their mothers for at least an hour or more are more successful with breastfeeding at subsequent attempts at feeding. Routine activities such as APGAR scoring and the newborn assessment can be done with the baby on the mother's abdomen. Other routine activities such as weights, eye medications, vitamin K injections, and bathing can be delayed until after the first feeding has occurred, or even longer. For mothers who have a cesarean birth, babies should be placed skin-to-skin with the mother as soon as she is able to respond to her baby. Dads could hold the baby in skin-to-skin until the mother is ready. Step 5 addresses the support for subsequent feedings. Mothers need additional assistance to assure successful breastfeeding throughout their hospital stay. Observe a feeding and offer coaching tips at least once each shift to help mothers get off to a good start. In the event a mother is unable to breastfeed initially, she should be provided with a breast pump and given instructions on how to store her milk for her baby. The milk can be given to the baby as soon as appropriate. Step 6 is to limit supplements to the situations where there's a genuine medical need. Medical need is defined by the baby-friendly criteria as a very premature or a very low birth weight infant, a baby with inborn errors of metabolism, a baby with acute water loss, a mother who is severely ill, the mother requires medications that are contraindicated for breastfeeding, or hypoglycemia. Think twice about whether a supplement is necessary or not. Often expressing some breast milk to give to the baby will meet the need. This step also requires that parents receive no free samples or items that have a formula company logo or a similar item. Advertising works, and these items are influential to new parents who are just adapting to life with the baby. This step also requires that your hospital does not receive complimentary formula for in-hospital use, but pays market prices for formula that's purchased. According to data from the Centers for Disease Control, the rate of supplementation for infants less than 48 hours old is slowly decreasing. It's the blue line. Our goal is to get this down to less than 10%, just for babies that have a true medical need. You can also see in this data that the rate of supplementation for babies less than 3 months old is decreasing. That's the green line, as is the supplementation rate for babies less than 6 months of age. That's the red line. Hospital facilities who are baby-friendly are expected to adhere to the World Health Organization Code on the Marketing of Breast Milk Substitutes. The highlights of this document include no free samples to healthcare settings. This means no discharge gifts from formula companies. They must be eliminated. No marketing directly to parents. No pamphlets or other advertising materials, and nothing that idealizes formula feeding. No gifts or samples to professionals. There should be no gifts, food, or other items such as pens, notepads, lanyards, or mouse pads provided to staff. Any information that's provided to professionals should be scientific and factual only. Step 7 assures that mothers and infants have unlimited access to each other so that breastfeeding can occur whenever the baby indicates interest. It also assures ample opportunities for skin-to-skin contact. Mothers can be transferred from the labor and delivery area to the postpartum area while in skin-to-skin contact. Just cover them up together, and then they should remain together in the same room. In hospitals where there are LDRPs, this happens automatically. In hospitals where there's no central nursery, this happens automatically. But in hospitals with traditional floor plans, just the arrangement of the separate areas for moms and babies fosters separation. So if you work in this type of a setting, you'll need to educate your parents on the benefits of togetherness and enable that to occur for your patients. Step 8. Mothers should expect 8 to 12 feedings in each 24-hour period, maybe even more. Feeding on demand encourages more frequent feeding and allows mothers to have the time to learn their baby's feeding cues before going home. Babies tend to cluster their feedings, so you can tell moms not to expect regular feeding times right away. Babies don't know schedules at this age. Step 9. Limiting pacifier use allows babies to learn how to breastfeed at the breast, maximizing the mother's milk supply, and it doesn't confuse the baby with a feeling of a firm, unnatural rubber nipple in their mouth. Similarly, bottles are quite different in mouthfeel and flow of milk. If a baby medically needs a supplement, choose a method that will not jeopardize breastfeeding. There are a number of alternative feeding methods available. The final step, Step 10, encourages providing or referring mothers to community support when they leave the hospital. Many studies have shown that mothers continue breastfeeding longer with support in the community. It can be a group based at your hospital or referral to a community group such as La Leche League. We want to grow breastfeeding-friendly communities so mothers can feel free to breastfeed if they find themselves in a public space whenever the baby finds a need to eat. And employers should provide accommodations for the breastfeeding mother who's returning to work. Whatever the venue, this ongoing support is essential. Around the world, there has been some exciting progress towards the baby-friendly hospital status. Since 1991, over 20,000 hospitals in 152 countries have been designated as baby-friendly. UNICEF reports that in Cuba, where 49 of the country's 56 hospitals and maternity facilities are baby-friendly, the rates of exclusive breastfeeding at 4 months almost tripled in the 6-year period, from 25% to 72%. In the first 2 years of baby-friendly implementation at the Central Hospital of Libreville, Gabon, cases of neonatal diarrhea fell by 15%, dehydration declined by 14%, and mortality fell by 8%. In China, which now has more than 6,000 baby-friendly hospitals, exclusive breastfeeding in rural areas rose from 49% to 68%. And in urban areas, the increase was 10% to 48%. The Catholic University of Chile, Santiago, initiated one of the first baby-friendly hospitals. As a result, initiation of breastfeeding within the first 2 hours increased. With a strong Step 10 and monthly clinic, exclusive breastfeeding at 6 months increased from 20% to over 60%. In Mongolia, the percentage of mothers breastfeeding their babies at 4 months has risen from 48% to 93%. All 27 major health facilities in that country have achieved the baby-friendly hospital status. In Sweden, almost all of the total of 66 hospitals are designated baby-friendly. In the UK, there are more than 20 hospitals with full accreditation and many more nearing completion. They have a rate of about 32% of all babies being born in a breastfeeding-friendly hospital. The impetus is certainly building in the support for breastfeeding and in the interest in becoming baby-friendly designated. Since the program's inception in the United States in 1996, there has been a nice increase in those that are designated hospitals. As of 2015, we're at 17.35%. This means that about 8% of the U.S. hospitals have achieved designation. Who else besides the World Health Organization and UNICEF recommends exclusive breastfeeding? Actually, quite a long list of august bodies have taken a stand in favor of exclusive breastfeeding. Exclusive breastfeeding for the first 6 months of life has been the long-expressed goal of the Department of Health and Human Services, the American Academy of Pediatrics, the American College of Obstetrics and Gynecologists, the Academy of Breastfeeding Medicine, the American Association of Family Practice, the U.S. Breastfeeding Committee, Healthy People 2020, the Association of Women's Health, Obstetric and Neonatal Nursing, and the Surgeon General. The recent Surgeon General, Regina Benjamin, called attention to breastfeeding with a call to action. This report outlines not only what we should as healthcare professionals be doing, but support for breastfeeding mothers needs to occur in workplaces, in communities, and in families. Dr. Benjamin calls upon us to ensure that the maternity care practices are fully supportive of breastfeeding, to develop a system to guarantee continuity of care between hospitals and healthcare settings in the community, to provide education and training in breastfeeding for all healthcare professionals who care for breastfeeding women, include the basic support for breastfeeding as a standard of care for midwives, obstetricians, family practitioners, nurse practitioners, and pediatricians. ensure access to services provided by the International Board Certified Lactation Consultants, and encourage greater availability of safe banked donor milk. Who else is looking at breastfeeding care in hospitals? The Joint Commission has instituted a perinatal core measure set. There are 5 measures in this set, and one of them is the rate of exclusive breastfeeding. Hospitals across the country are measured and compared by the Joint Commission against all other accredited institutions in their performance in a wide variety of indices. The core measure set on perinatal care includes elective deliveries, cesarean sections, antenatal steroids, newborn bloodstream infections, and exclusive breast milk feeding. The mPINC score is the results of a survey conducted by the Centers for Disease Control every 2 years, and it asks hospitals to rate themselves on their maternity practices. Results are reported by state. The individual hospital report was sent to a representative of each hospital, and these reports are not available online at this point. They can only be obtained from your hospital representative. So what is a breastfeeding report card? The Centers for Disease Control has taken data from the National Immunization Survey to monitor the rates of breastfeeding around the U.S. I have included data here on Utah and Louisiana because they represent the range of scores. They had the highest and lowest scores. I have also indicated on this chart whether the scores have gone up or down from the previous year. In most cases, they've gone up, which is good. But in some cases, we've actually lost ground in our breastfeeding rates. There are many influences on a breastfeeding mother. The mother has her own concerns about breastfeeding that begin during pregnancy and in most cases continue until she successfully initiates breastfeeding. The first professional influence comes from the obstetrical staff. Their influence is during pregnancy and diminishes shortly after delivery. This is the ideal time to initiate the conversation about infant feeding plans. Next is the pediatric staff. Their influence begins at delivery and continues for as long as the mother breastfeeds. The maternity staff have a big influence during the hospital stay. The family, the workplace, and the mother's social pressures are influencing her decisions during pregnancy. They're less influential during delivery and when professionals take over, and then become more influential again as she gets ready to go back to her usual role, maybe returning to work, and certainly becoming socially active again. So you can see that the time of hospital care and the influence of the maternity staff is the most influential, but for the shortest period of time. We on the maternity unit have the opportunity to make it or break it for the mom. She deserves our best support. Redundancy. What does that mean? We hear about redundancy in fail-safe systems like the space shuttle. There needs to be several systems that can take over the same functions. Just in case one system malfunctions, the mission will not be lost. We need that too. Everyone needs to be trained in reinforcing the same message to mothers. If one person gets busy or gets called away, another staff member can step in and provide the information or support that's needed. Be alert to your team and the workload. If things get too hectic, where can you step in to make sure that breastfeeding support is consistent? Or when can you alert the next team member that something was not done? Can they pick up on that for you? Your coworkers can be the backup for you when you get too busy, or you can be the backup for them when needed. That's the beauty of a redundant system. Even if you do not provide direct care to patients, your role is important. If you're in the mom's room to draw blood, or to do a hearing exam, or even to deliver a meal, change a light bulb, or take out the trash, you can make a supportive comment that reinforces your support for breastfeeding. You can provide support for breastfeeding within the scope of your role. A smile or a nod lets the mom know, if she's breastfeeding at that moment, that you think it's a normal activity, not something that she should cover up or be ashamed of. Follow her lead. If she needs privacy while she feeds, provide it. If you're on the admitting staff, you can proudly say, "Our hospital is baby-friendly," and so you'll get lots of help with breastfeeding your baby. A comment to a mother that she's doing the best thing for her baby can go a long way to empower her to continue. If you see a mother who's having a problem or is uncomfortable, offer to get the nurse to assist. How can the Baby-Friendly Hospital Initiative benefit your hospital? What's in it for you? First of all, the standards for baby-friendly hospitals are the state-of-the-art for breastfeeding care for mothers and babies, and we do want to provide the best care. Patients appreciate the care and attention to making sure breastfeeding is successful, and this improves our patient satisfaction scores. Being baby-friendly elevates our status in the community. Parents may choose our hospital for delivery because of our reputation and our designation as a baby-friendly hospital. Being baby-friendly dovetails with the standards for exclusive breastfeeding with the Joint Commission, as well as improving our scores on the breastfeeding report card that the Centers for Disease Control issues every 2 years, and the metrics gathered by the Department of Health and Human Services for the Healthy People Goals 2020. Breastfeeding is the gold standard in infant feeding. Babies should be exclusively breastfed for the first 6 months of life, and that begins with us and the care that we provide in the hospital. I'm sure you have had times when a patient has said to you, "Thank you, you have really helped," or "What you have done has made such a difference. Oh, thank you for spending that time with me." And you felt so gratified. This is what you came into the health professions for. It changes your day, or your week, or maybe even your whole career. Breastfeeding is a very personal act. Being able to empower new mothers to breastfeed can be a big moment in their lives as well. This can be the moment that women grow into their new motherhood role. We'll be working towards baby-friendly hospital status to enable us to give moms and babies the very best start.